Well, thank you, Chairman. Well, good evening, ladies and gentlemen. Uh, it's the topic about emerging opportunities in information technology from the PSU perspective. Of course, there are a few points which Mr. Bakshi has already mentioned. In government also, we have the ERP systems, the procurement portals, etc. They have brought about a huge transformation in the way the businesses are conducted in the government environment. Of course, there is one difference for our organization, that's TCIL, that we offer these services, the ERP service, the e-tendering platform and other managed services also to other government and public sector enterprises. So today I'll be talking about some of these emerging opportunities from the public sector perspective also. And I want to talk about one of the ICT project examples which we would like to showcase, and if the time permits, a little more about TCIL. There are a lot of challenges that developing nations face. One of them is empowerment of the citizens. Poverty is a big challenge. Food, water, education, health services, transparency, these are all issues which are common to most of the developing nations. And, India itself being a developing nation, the challenges are much bigger. We have 1.2 billion people. We have about 637,000 villages, and 70% of our population lives in rural areas, rural India, and 65% population of India is below poverty line. That I want to underline. Now, what are the solutions the ICT can offer in the current scenario? India, as I mentioned, because the rural area forms a major component of India, there are, challenges which can be met through some of the important initiatives. One of them is the National Fiber Optic Network, wherein about 250,000 villages at the Gram Panchayat level, they are being connected on optical fiber network to the mainstream network. This is bound to improve the teledensity. It will provide broadband to the rural areas, not just for surfing the net, but for uses like education, health, e-governance, mobile banking, and local employment generation. For empowerment of the citizens, I think it is already discussed in the morning also about enrollment of the citizens through biometric parameter base. I'm not going to talk much about it. And for rural areas, there can be money transfers directly into their accounts, and they'll be able to use their money through M-banking. So, apart from land record details, right to information, which already empowers the citizens, there is a lot of potential for even the financial inclusion, providing them, for M-banking. So far as food is concerned, ICT also plays a major role in this food technology, optimizing on food production. Satellite imagery can give us quality of arable land in the country, which definitely improves production. We already have a farmers' call center. It has been established by TCIL in India. Of course, herein the farmers can solve all their problems, can get answers to all their queries on the Kisan Call Center. It's a toll-free number on which experts answer all their queries around the clock in their local language. And this experience has also given us another input. That is, whenever there are similar type of complaints or similar queries from a particular farmer, from a particular region, from the farmers of a particular region. It could be some telltale signs of an epidemic in the waiting, and if a proactive action is taken, all such catastrophes can be avoided. And that is how the Kisan Knowledge Management Center, or the Farmers Knowledge Management Center, came into the picture, and it is quite effectively being used by the government proactively. For water management, water can be controlled. It ensures equitable distribution, and every drop of it can be accounted for. We have done a project for automated gate control for Sardar Sarovar project, and I'm sure similar projects would be replicated elsewhere in the country for managing water, because as they put it, water is going to be one commodity over which the next world war is going to be fought. Now, coming to education, of course, all of us are aware that e-education is, of course, not a luxury. I keep on repeating this. For a country, for a developing nation, it is a must. For a developing nation, this is the only way it can be done, because we have acute shortage of infrastructure, and in the conventional way in which the developing nations are handling infrastructure with the amount of resources at their disposal, it simply cannot be done in a developing nation. There are virtual scopes for virtual classrooms, tele-education portals, digital content development, skill-enabling courses, learn as you earn. There are many people who are not as privileged as us to undergo formal education. For them, it's really an opportunity in terms of one of the government initiatives being National Skill Development Corporation, wherein even those people who have had no formal education can eventually move in that particular direction horizontally, so that they also are a part of this change and don't miss on it. Employability is one of the major challenges. In the morning session, I was in the education stream of this conference, and it was quite a concern of most of the speakers that the quality of the products coming out of the modern engineering colleges, it's not up to the mark, and a lot of challenges are being faced in that direction, and employability becomes a question mark. And the reason for this is good quality teachers. You cannot simply multiply teachers by n and ensure their unlimited supply. So that can be met only through e-education. In the health sector also, there are a lot of challenges. We have, with so much of population and so many villages, 637,000 villages, it's simply not possible to provide doctor in each of the villages. So we have to have innovative solutions for maintaining citizens' records and ensuring continued medical education for doctors and nurses, and even taking care of the health of all the human beings. It's quite encouraging to see that in states like Gujarat, they not only take care of the human health, but also the health of the animals. It's very interesting. There is a e-health model wherein a local villager can be trained as a paramedic, and he can sort of become the focal point of rural health. He has a small kit which contains most of the medical equipment which we need, including the ECG machine, blood pressure monitor, glucometer, etc. And along with a laptop and a mobile phone with a GPS, he can interact with the call center as soon as he gets a call from one of the patients in the village. And generally this particular paramedic, since he's from the same village, he'll be known to everybody. So hence, the first level of treatment can be done through this call center. if the doctor who man the call center round the clock in a big city, if they feel that this patient needs to be examined carefully further, so they can even take a specialist on the line, and if they feel that it cannot be handled remotely, they can bring him to the hospital. They know the location of the patient with the GPS of the paramedic and send an ambulance over there. Similarly, for ensuring transparency, last year we have had a lot of protests on anti-corruption drive. Everybody wants that the corruption should be eliminated from the country. And we all know what happens at government to citizen level. There are a lot of challenges, and these can be controlled electronically if all the citizens are able to get their services online. There has been a lot of discussion in the previous session about that, and file movement and even the post-tax collection process can be streamlined. There are two states in India, rich states, both share a common border, and when the vehicles travel from one state to another, the toll is equally shared between the two. But the difference is that in one state, everything is monitored centrally in the capital. Every time the lever operates and the vehicle moves, people know how much collection has happened. In the other state, although they collect the same amount of money, but it's all manual, and the difference in collection, which should be equal theoretically, is 500 crores a year. Now, this is not a small amount, and this is all happening because transparency is a casualty here. And this is not a story, this is a real fact. And here, if time permits, I would like to quickly take you through one of the live examples of empowerment through ICT, the Pan-African e-Network. It's an initiative of Government of India in collaboration with the African Union Commission. It was conceived by our former President, Dr. Kalam, and supposed to have three components: tele-education, telemedicine, and VVIP connectivity. If you see this slide, you'll notice that on the left-hand side is the Indian component, on the right-hand side, the African component, and 12 leading hospitals of India and 5 leading universities of India are linked to Africa. 48 countries at present, and it's a network which is already functional for the past 3.5 years. These are some of the universities and the hospitals which are a part of it. Some of the African hospitals which are supposed to perform the same role as the Indian hospitals after the completion of 5 years, which happens in July 14. These hospitals will be providing the same type of service. In fact, there are a lot of major components in this project, and it was a challenge by itself, including construction of the hub station building, establishment of a satellite-based network over there, ICT, data center, VSAT network, medical equipment, practically you can say every type of engineering, including the IT, and the way it has empowered the entire African nation, it gave us a lot of ideas how this can help even our citizens in India. The major benefits which were intended for this, through this project were training about 10,000 African students, providing them degrees, postgraduate degrees, etc., and online medical consultation and advice, and continued medical education in the field of medicine. The project has been successful because we have almost reached the 10,000 mark, almost 2 years ahead of this completion of the project. 48 countries are signatories to this. As on date, we have implemented almost in all the countries. 47 were already complete, 48 is being commissioned. 9,780 students have already registered on this network for post-graduation and other programs. And with 2 years more, we expect to far exceed this particular target. These are some of the snapshots of this project. We have started this from ground zero, and these are some of the stations. We have established a station in Dakar, Senegal, West Africa, and this is the data center in New Delhi. And it's all a collaborative mode of operation. This is telemedicine session in progress with one of the hospitals in India. A learning center. And this Dr. Kalam in Care Hospital, he always has been a great source of inspiration. He delivered a special lecture in about a few months back from our studios. About 1,800 people, doctors and VVIPs, they attended this session. There were 85 questions put to him, and he answered all of them. There are other networks also we are working on, and of course, I don't think we have the time to discuss all about this. I'll stop at that, but there are a lot of services that can be provided through networks and ICT in general. Thank you very much.